Cool. So I think, are you going to have to be the one that admits everyone?
Oh, they're coming in. I see.
Oh, okay, cool. Awesome.
Yep, I see people coming in. Yeah. Maybe as the only the host can see that. Is that?
Okay, I can see it too. Yeah. Hey everyone, welcome. Thanks for coming and joining us today for Lunch and Learn. We'll just take a couple minutes here and let everyone filter in, and then we'll begin our session. All right, I think are we ready to go? Awesome. All right, everybody. Thanks again for joining us for our second installment of our BiomeFx Lunch and Learns. Today, we have the great pleasure and honor of having our guest host, Dr. Corey Feldman. Dr. Feldman is located locally here in Chicago, where she runs a family medicine practice. She is an MD with a wealth of knowledge on a variety of topics, and we are lucky to have her on our BiomeFx consulting team, where she's able to consult with you about your complicated patients and their BiomeFx results to develop a really solid action plan, utilizing a great roadmap back to health. So we're really excited for her fascinating case study that she'll be sharing with us today. So I will hand it over to you, Dr. Feldman, for the next hour here so we can learn with you.
Awesome. Thank you, Lacey. So I am super excited to be here with you guys today to talk about a good case with you and really help you get a great understanding about the overview on how do we look at this test, what are the benefits of it, and most importantly, how can we clinically use it to help our patients really in the best way possible. So what I want to do first is I just want to give you a little bit of overview in terms of the patient that we're going to be looking at in the report. And in the chat, if you guys want to click on it, you'll also be able to get access to the report as well that we're going through. So you can look through that and have access to it as well. So who we're going to look at today is a 34-year-old woman. She actually had filled out a nice questionnaire, so I have a good history on her. You may or may not have your patients filling these out, but it's helpful, obviously, if you're not very familiar with what's going on. So she does actually have a history of SIBO. So this is going to be interesting to kind of look at that in the background. And then she's having bowel movements every other day. But she is eating pretty clean, right? Dairy-free, gluten-free, pescatarian diet, she says, doesn't drink alcohol. She's exercising a little bit, a few times a month, walking and cycling. And in terms of her sleep, she's okay, 6 or 7 hours a night, but she is feeling fatigued. She says significant fatigue during her waking hours that always affects her typical day. So that's more brain symptom interesting. And then last time she took oral broad spectrum antibiotics was less than 3 months before this test. So that'll be interesting as well to look at. She's not taking any medications. And then she is having a series of GI symptoms. So the biggest one is bloating. And then she's also having some gas and diarrhea. And then rated less highly was the abdominal cramps, pain, and constipation. Although she did say she's having bowel movements every other day. So let's dive into her report and see what we can come up with in terms of what's happening. So I'm going to share my screen. All right. Hopefully you guys, can you let me know if you can see my screen? Hopefully the answer is yes. Okay, great. Thank you, Jessica. All right, cool. So what I want to start with here is, this is our overview snapshot page when you get started here. And so I like this page in terms of if you just want to get the 10,000 foot view in terms of what's going on with your patient, this can give you just a quick idea about it. And then we're going to dive into it, of course, and go through details here. The gut microbiome index, this is more of your overall, like, how is your gut and microbiome performing? Above 30 is really ideal, but most of the people that we're seeing in the testing are really in this, peach to orange range. And that's where she is, not surprisingly, given her history. Alpha diversity is really helpful, and one of the most important things that I like to look at on this page, because this is literally just looking at like how many species of bacteria are actually living in the colon in the sample that was given. And you can see she's kind of in the toilet here with her red result. And if you go to the next page here, you can see they break it down here on this little graph to show you that the average US healthy population is somewhere between like 120 and 200 species. That's ideal. And above 200 is really like optimal even. And look where she is. She's at 73. That's super, super low. So as you can imagine, this is going to create all kinds of problems, as we go through this, and obviously contributing to her symptoms. So it's always really helpful to just, number one, just understand like that alpha diversity needs to come up. That's like, if that's one of the biggest takeaways you get from this, that's so helpful and important. Beta diversity here is, really looking at the quality of the bacteria that's there. So it's interesting, right? Because she number-wise has really low bacteria, but then quality-wise looks to be in the green, which can be deceiving and not necessarily giving you the whole picture. But this is really just kind of comparing down here to average US healthy populations. And you can see, again, she does look like she's okay here, but with this low alpha diversity, I'm not going to be super excited about that right now, because I know, there's other things we need to work on. The resistome is really looking at how resistant is her system to pathogens and problems. And most people are going to be in the lower range. She's surprisingly high, in my opinion, considering she was just on the antibiotics and what's going on with her. But things like antibiotic use, travel, poor diet, exposure to toxins and things like that can really push this down. So, I mean, she's not optimal, so we definitely want to work on that. And then this kind of gives you an overview of the pathogens. We're going to talk about that in more detail as we get further into this. And then Bacteroides fragilis obviously was one of the things that popped up for her. So again, we'll talk about that. This is a snapshot of the Keystone species. And so if you're not familiar with them, they are a very small population of bacteria in the microbiome that have a very large influence on everything. I call them the microbiome influencers, if you will. So they are very, very important. You need them in force, you need enough of them, and they also need to be functioning really well. So if you look at the functions that, the test really dives into, you can see she's across the board, she's really low in a lot of things. So just from a snapshot and 10,000 foot view, she has a lot of things that we can be working on. So this is always exciting because, of course, as practitioners, when we do testing, of course, we want to know what to do with things and what can we work on. So this is helpful. All right, so then as we keep going along, this page, again, just kind of breaks down what we just looked over on the top in terms of those factors. So you can dive through that in more detail at your leisure there. Okay, so now we started at the 10,000 foot view and we're trying to come down and get deeper and deeper and more detailed and specific into who's living in the microbiome and how are they functioning. And so the next level that we're going to look at as we get closer down is your phylum. So for those of you that remember your biology classes from school, phylum is still a pretty large category of organisms and bacteria and things. And so what we did here is the donut here on the left is looking at your average US healthy population. And so when you look at this sample compared to the US healthy population, just by color and looking at that, you can see she's slightly off from what the average healthy population has. She might have a little bit more Bacteroidetes present than the healthy population and not enough of the firmicutes. And then you can see color-wise, there's some other, there's not as much of the color going on here. So this is just helpful, again, as an overview and just telling you diversity needs to be increased. And the big name of the game here is balance. It's not necessarily that you need to get rid of anything, but you just want to be balancing things out. So I always like to, again, look at these in relationship to the patient and the symptoms and things that are going on. So the top 5 phyla that are listed here, these are your core microbiome phyla. So your keystones live here, and it's very important for these guys to really be in balance. So you can see just by looking at these bars, she's really low on a couple of these really important ones. And then she's a little bit higher on this one, almost in the green on the other two. So she's not quite balanced the way that we want her to be. So again, just from like a general stance of what do you want to do with it, with her, balancing this microbiome is going to be important. Now, the bottom ones here, these phyla tend to be your troublemakers, if you will. If you see the green boxes on the left for these, because you really don't want these overgrowing. And when they are overgrowing, you are going to notice that they are related then to some of the symptoms and things that are going on with your patient. And so I want to point out on her, she actually has a Euarchaeota really high actually in this red area in the 92% range. And Euarchaeota are really interesting because they're not necessarily even bacteria. They're a different type of microorganism, and specifically methanogens and the organisms that produce methane live here. And so I mentioned that because remember, she has the history of SIBO. We're also going to see further down in this testing that she has some methanogens and methanobacter going on. So this is just a clue. So when you're looking at these, you're always going to kind of see clues around things. Nothing is super necessarily diagnostic in terms of like, oh, she has SIBO, but again, clues are the issue here. So we really want to be able to connect the dots. I love being able to connect the dots to what we see and what we know about the patient, and of course, what we can do about it. When you look further down here, this actually breaks down what we saw up here and shows you these numbers are the relative abundance in her sample. And these numbers should equal 100%. So you'll be able to see, okay, you know, she's missing these two main ones, the Verrucomicrobia and the Actinobacter, which is super important. We're going to talk about that as we get into Keystones. And then her sample percentiles here is basically just these numbers put down here. So you can kind of refer back up. Whichever way you learn best and can visualize best, they put it all in here for you. So I like how they do that. Okay, so then we want to get deeper into family levels now. So underneath the phyla, let's look at the different families. And again, US healthy population on average is looking like this, and this is our sample. So just by the colors, you can see that things are off. And not quite where we want them to be in terms of the healthy population. And again, our Bacteroides is really larger than we want it to be. When you look down here, they also show you the families and they bring in the phyla here. So if you want to geek out on this and really remember where everything lives, it's super helpful, I think, just to be able to see them side by side. And then again, you can see your relative abundance in her sample and then her percentages as well over here. And so this is, again, just a nice way to help you understand, you know, where is she at and what does she need to get more in balance. Now, when we move further on the next page, the page 4 here, this is your family level, but this is what we call our fingerprint page. And so what pops up here tends to be very specific and rare to the actual person and the host, and not necessarily what we see in everybody. Like the stuff that you see on this page is generally common in most people. And then again, down here is going to be more specific. So I always like to pay attention to what do we find on this fingerprint page, because it's going to, again, give us more clues as to what's going on. And with her, we actually see one of the firmicutes families of the Streptococcaceae. This one is interesting because you can see this a lot in SIBO. And remember, she has a history of SIBO. So I'm actually suspicious now, like, was it really treated and was it completely resolved, you know, at some point, or has it just been simmering this whole time? And so that's something that's giving me that clue. You'll see this overgrowth as well, and it is pretty overgrown in the 90th percentile. You'll see this with antibiotic resistant infections. And remember, she just took antibiotics a couple months before, within a couple months of this test. You can also see this in a lot of times in abscesses, sometimes in different parts of the body. Now, she didn't mention that, but again, these are the things I'm thinking about as I see these things. Methanobacteria, this is one of the Euarchaeota that I mentioned earlier. And again, isn't necessarily all bacteria. And these guys really produce your methane, which if you remember if you know anything about like SIBO and things, this is not a good thing. You really don't want these guys overgrown. And you can see she's significantly overgrown on this. With the low alpha diversity, remember how few bacteria she actually had living, all the few species that she had in the alpha diversity, that actually gives us a clue. If the good guys are not in strong enough forest, your bad guys, your troublemakers are going to overgrow. And so this is just confirming what we know about that. So I don't want you to get too lost in the weeds of this. But in general, these guys, the Methanobacter, tend to be really troublesome in terms of balance, right? They thrive, they're really robust. They eat lots of different substrates. They compete with some of your other bacteria that make the short chain fatty acids. And so it can be a real challenge sometimes to really get this under control, as some of you may have learned. And so we really want to get these guys, again, back in line and in the smallest amount, because you don't want them causing a lot of problems. And for her, remember, she's having a lot of gas and distension. And she is having constipation. So I'm suspicious that these guys are really causing a lot of those symptoms for her. And so again, we really want to clean these up and really get her into better balance, and specifically with those keystones and the good bacteria. So I don't want you to get too lost in the weeds of this, but I wanted to, again, just give you a little bit more detail about the families that you'll find on page 4 that can be really helpful and give you good clues. So then as we keep going along, these are ratios. These dysbiosis ratios are really helpful. Some of you may have learned about the Firmicutes over Bacteroidetes ratio, and if it's too high, it can be linked to like obesity and autoimmunity and all kinds of things like that. This is what we find usually when this ratio is a lot higher, so like maybe over 2. So for her, this is, not a challenge for her, but you might see that in some of your patients when you test for this. Now, her Proteobacter over Actinobacter is non-existent, not applicable, because if you look over here, she really doesn't have that Actinobacter. And if you remember up in the phyla, remember there's 2 main categories of the core microbiome that were not present. So the Actinobacter was one of them. So that's a problem, right? Because Proteobacter can be really inflammatory. And so we really need to help her build her keystones and foundations to make sure that she doesn't become too inflamed, right? So, not what we want, where we want her to stay. Same with the Prevotella over Bacteroides. This one is important, and I see this a lot actually. And Prevotella is a 0. That's the problem here. And she's got a lot of the Bacteroides. And you'll see here in the notes, like they talk about how Prevotella really thrives on healthy foods like your fibers and your fruits and vegetables and whole grains. And it does decrease with age, but I have been suspicious and found a lot of times that when this is 0, some of the diet that people are telling you they're eating may not be exactly true. In her case, it sounds like she's eating pretty clean. So then I start to think like, okay, so then the food's getting there, but it's not being utilized, right? Like it's not being processed and used by these bacteria because maybe it's not digested enough. So those are the things I'm thinking about when I see this, and really want her to be eating the way that we need her to, with a lot of the fruits and vegetables and things, but also being able to utilize what she's eating. And then your Bacteroides really thrives on the sugar and saturated fat in your standard American lifestyle. So again, you'll catch some of your patients sometimes telling you that they're eating really clean, but a lot of times this will be able to help you help them understand, like, guess what, this is what we see. And so we need to keep working at this. So this is, again, a helpful tool in that way. Okay, so then next, and if you guys have questions, you can go ahead and throw them in the chat as we go here. I'm happy to try to answer them as we go if I'm not answering your question, but I'll just keep going. So then the next section is this pathobiome. So this is a really cool section that I love that they're testing for, and I'll show you exactly what's being tested for. I believe it's like 34 different species are being tested for. And it's really cool because they break it into bacteria, protists, fungi, and viruses. And so these are all of the things that have been looked at in the sample. And you can see of all the things that were tested for this patient, Bacteroides fragilis actually popped up pretty significant, 2.25%. And if you remember, her keystones are very low, right? Like in her number, alpha diversity and general number of species identified was very low. And so likely some of these troublemakers and pathogens are overgrowing because of that, right? These guys are being overtaken. The keystones are being overtaken like that. And so again, balance is the key, and we really want to be able to push this down. But the good news is we also test for virulence factors here, which are genes that tell us if they are present, that they are more likely to cause problems and cause disease in the host. And so there's a bunch of C. diff toxins that got tested here. We didn't even see C. diff for her, so that's good. But in general, we are seeing a lot of that in our population. And then the Bacteroides fragilis, though, actually wasn't detected either. So that tells me that this isn't necessarily a super important problem that we need to like focus on first, like all by itself. You know, in the conventional scene, we're always like, oh, a pathogen, we got to like slam it with antibiotics or antimicrobials. And that isn't necessarily the case, especially if, again, your virulence factors are not present. And so, yeah, so Joanna, I really like this new format and list of pathogens too. I think it's much easier to really think about and keep track of what you're trying to do instead of getting lost in the weeds of too much detail. And so I like being able to, again, connect the dots between what we're doing and what we're looking at. You will see sometimes this overgrowth of Bacteroides with abscesses again. So again, there's some clues here that maybe, and a lot of times when you do talk to your patient about this stuff, they will tell you, oh yeah, I was having, you know, mouth abscesses, or, you know, I needed a root canal, or I was having like these boils somewhere or whatever, right? So then you're like, oh, cool. So it's really exciting because you can really connect the dots between these things, even if they haven't necessarily given you that history. Autoimmune conditions also, you'll see sometimes this overgrowth as well. And then C. diff, we are seeing a lot of C. diff. There are some parasites that are being looked at, the protists down here, Jessica. And so you can kind of see here, this isn't necessarily, again, a diagnostic test for that stuff. So if you're really concerned about that specifically, you could always do further testing, but this is an overview test to really look at some really good pathogens that can be troublemakers. I just want to talk about C. diff briefly, just because it's common. Yep. And I've been seeing it a lot. And so usually like above a 2% is something that you'll see a lot more symptoms for in terms of like diarrhea or blood in the stool. And then above 5 or 6% is where you'll see somebody in the hospital. And so again, being able to test for the virulence factors for that is going to be really helpful. And C. diff isn't necessarily a problem for everybody. A lot of people carry it, especially if we've ever worked in hospitals or, you know, just been around anyone that's had it, a C. diff infection. And so it's not something you have to like put your red five alarm alert on if you see it necessarily, but this is a cool way to, again, kind of let you know. And just so you know too, if something comes up on the test that that is a red flag, you as a practitioner will get alerted about it too. So not to worry about that. All right, so then let's keep going. Okay, so then the next section here, this is your keystones. Oh my goodness. You can already see on the right, she almost has no keystones. It's insane. And as I said, like these guys are so important. They're your major influencers of your microbiome. And she has nearly none that are present here. And so this is a huge problem, and for sure has been, you know, related to a lot of her symptoms that she's having. So we really, really want to work on this and really be able to help, you know, bring this up. Now, we can't necessarily just throw bacteria down there. Like that was the old way of thinking about things. Like you have, you know, your high dose probiotics, if you really throw them down, you hope they stick to the walls and stuff. And so what we really have to do is help your own body or the host body to be able to modulate and communicate better with who's there and help them really grow, right? The good guys that you need to grow and really help to get things better, back in better balance so that you can keep your pathogens and bad guys down. And so, so there's a lot of different ways that we can be working on this. We're going to talk at the end here about specific recommendations, but you guys, this is one of the biggest things going on with her if you take nothing else away from this, like she has no keystones and she really needs these guys to be increasing in size, in number, and in function as well, so that she can actually function better. And I'm a family medicine doctor, so I love this because I feel like the microbiome is sort of the family medicine of health in a lot of ways, and it really touches all kinds of areas of health. And so that's why it's been really fun for me to learn about this as well, because again, if you can really start to fix gut and microbiome health, you can start to improve all kinds of things that didn't necessarily you maybe didn't even know were connected before, with the brain and autoimmunity and hormones and all of these other things as well. So it's really exciting. Okay, so one of the things I want to point out to you guys just briefly here is on the BiomeFx website, there are some tools that can help you. I just wanted to show you the recommendations, report recommendations. Is a 29-page document that's on there under the education if you guys are interested. Yep. And Mary, it looks like we dropped the website in the chat. And in the middle of this is this functional fibers table. And so I really like this for you, and then also for your patients if you ever want to help them like do food first and like try to use less supplements, because I'm not a big supplement person. I don't want people stuck on 20 different things. And so if you can use food in the kitchen, I want you to be able to do that. And this table is super helpful, I think, in terms of breaking down like where certain fibers live and what the food sources are. But I also wanted to bring your attention to underneath this is super cool, is they break out the keystone species one by one, and they show you if they're low, what you can do nutritionally, lifestyle wise, and supplement wise. So it's a really cool tool, I find, as a practitioner, to be able to kind of like dive in. And if we go back to our report, you can see, for example, Akkermansia muciniphila is not detected. You guys, this is super important. It's one of the most important of the influencer here, because this guy literally eats the mucus in the lining of the gut while you're fasting. And then that actually encourages the cells of the GI tract to make more mucus to create that good barrier, so you don't have such a leaky gut, if you will, right? And so, of course, if you don't have Akkermansia there in particular, you're just wide open now to get less protection going on, and you can have a leaky gut more, and then sort of all kinds of things that you're eating and getting exposed to in your GI tract can get into your bloodstream and cause all kinds of problems, right? And they are for her. We see that. And so if you wanted to, if this was, I mean, she has a lot of things going on, but let's just focus on Akkermansia for a second. If you wanted to go here, it could show you, like, specifically for Akkermansia, you could reduce intake of sugar. You know, a lot of standard American lifestyle eating is full of sugar, right? So that can be super helpful for this. Consume more sources of your fructooligosaccharides. Cranberry polyphenols have also been shown to increase this. Intermittent fasting can be really, really helpful, which makes sense, right? Because the fasting period is where these Akkermansia then could really feed and grow. Moderate exercise a few times a week can be helpful, and avoiding prolonged exposure to cold, which I'm with the Akkermansia. I don't really like the cold myself either, even though I'm in Chicago. So they, you know, cold plunges and things like that have been very trendy and helpful. But if you don't have Akkermansia growing, it's not going to help that situation. And so, yeah. Yes, and that's a good question, Joanna. If you don't have any growing, can you grow it? And yes, my understanding is, you know, they're still, like, the seeds are still kind of there, but the environment is not right for them. And so what you want to do is you want to give them the right, really build the seeds up and give them the right nutrients. And go ahead and correct me if that's not exactly right, Lacey, in the chat. But yeah, this is my understanding of this. And so, you know, you can really start to set the stage, if you will, to build these guys up. And this is some of the ways that you can do that. Because, you know, our test only goes to a certain limit, right? A certain level of what they're detecting. And so just because it's not detected doesn't mean that there's zero there, if that makes sense. And so the idea is, again, to really encourage them to grow. And yep. Yep, exactly. So we throw everything at it so we can help it grow. Exactly, Lacey. So so the idea is, again, because if we couldn't, again, do these things, nutrition, lifestyle, and supplements, if you couldn't grow it at all, this wouldn't help, right? So the idea is they are able to grow, but in the actual test, oopsie, here we go. In the actual test, it's the level that they're looking for is not detected, if that makes sense. And so, yeah, so we definitely want to really help support these guys. That's one of the biggest take homes from her test of all things that we want to do. So if you guys want to look at that at your leisure, obviously that's going to be helpful. The other thing I wanted to show you is the keystones are some of the major producers of your short chain fatty acids, but there's other bacteria and microorganisms in your sample that are producing some of these other short chain fatty acids. So it's a really cool way, again, to show you that it's not just about the keystones, but this is how she's doing overall in terms of, she's making a lot of acetate and lactate and less butyrate, and then lactate and propionate. And so this is just a nice way, again, to kind of tally that up for you and to kind of show you what's going on beyond just with the keystones. Okay, so now we get into the function. So remember, we care about like who's there, how many of them are there, and then also not only are they there, but are they functioning well? Because even if they're there, if they're not functioning well, obviously it's not going to help. And so this is a really cool way of starting to look at the function. So one of the things that we look at is the type of fermentation and fuel that the bacteria are creating and using. And the keystones really prefer the saccharolytic, which is basically processing your sugars and your carbohydrates. Carbohydrates have been vilified in the last couple of years, especially, like they're horrible, but here's what we find. If you do not eat them at all, like so many people are barely eating them, you're starving your keystones. If you starve your keystones, you're going to cause a lot of problems for yourself in other ways that are unforeseen. And so we really want the saccharolytic fermentation to be good. Sometimes if it's not going on, if you're not eating enough of the fuel with the carbs and the fiber, the bacteria will move over into protein or proteolytic fermentation to make the short chain fatty acids. And this is okay, but it's not as efficient and effective as doing a carbohydrate or saccharolytic fermentation. And the problem is there's a lot of byproducts that can come out, and they can be pretty inflammatory. And so you really don't want your proteolytic to be too high. So when we look at this patient, she's not detected even with her saccharolytic. And so remember, she's eating dairy-free, gluten-free, and pescatarian. So again, is she eating enough fiber, number one? And if she is, she's not utilizing enough. So I'm going to start to think about like digestion with her, upper, GI digestion, and how to really break things down better. And also just make sure she has enough of the carbohydrates. Yeah. And so exactly, vegetables are complex carbohydrates. We're talking about the non-digestible fibers. And again, if we look at this table here, Connie, this can be helpful too. All of these different things can be helpful, your cellulose resistant starches and things like that. And so this can be helpful in terms of your patients being like, well, I do eat vegetables, but then we learn, oh, they only eat like 2. They're like the less complex type, or, more of the glycemic spiking sugars. And so that's a good question. It can be helpful. But in general, we see, we want to really increase this for this patient. Iceberg lettuce, exactly. But I eat lettuce. And so, well, that's where that table can be helpful, guys. So you're welcome. Give them the sheet so that you can say, no, all of these different things can be helpful too. And this is how you can map it out. Not surprisingly, because her saccharolytic fermentation is low, butyrate and propionate are not detected. And then her acetate, though, is pretty high, considering she's got no saccharolytic fermentation going on. And then her lactate's pretty high too. So I'm also wondering, like, does she have too much bacteria? Again, troublemakers that maybe are making too much lactic acid, because it can be really helpful, but if it's too much, it can cause more inflammation. And so, yeah. Let's see, Cynthia, clients print out the fiber table and circle week by week what they eat. Good game for folks to try to circle as many as possible. I love that. See, there's all kinds of ways that you can use these resources. And that's the kind of thing that I encourage, because a lot of people say they're eating healthy, and you guys hear it all the time, right? But, the test doesn't lie. And so again, it's a really nice tool, you guys, to prove to your patients that you're like, I believe you, but the test is not showing that. So it's a helpful way to be able to look at this and to help your patients more. And Joanna, that's okay. This is being recorded, so you'll get the recording. You can watch the rest of this as well later. Glad you're able to join us, though. Okay, so then proteolytic, interestingly, it's low, but with the no saccharolytic and low from proteolytic for her, like ultimately she's not really digesting well. That's what I'm taking away from this. And so it's like, how can we help her with overall digestion? Again, higher up digestion, because this is looking at what's happening in the colon, right? And so what we want to do is help her break the foods down and the nutrients down better, so that when those nutrients get down there, and especially the carbohydrates, the keystones can see it and use it and thrive and grow that way. And so, you know, when you see high proteolytic, then you start to see some of these byproducts be high too. But for her, she's good. Like her polyamine's good. But interestingly, look, like her phenols are actually a little bit high as well, and her ammonia. And so, you know, the phenols can be really toxic to the gut lining as well. And these, again, are byproducts, if you remember up here, of your proteolytic, your phenols, and your ammonia up here as well. And so, you know, they can be really irritating to your gut lining. And so we really just want to push more towards that saccharolytic and less proteolytic fermentation. And so for her, it's interesting because she's kind of low on both, but still having some phenols come up. So we really want to push that down. How do we push that down? Again, you got to get your keystones working better, right? So that your foundation influencers are really doing their job well to keep your troublemaker bacteria and microorganisms down and not causing too many problems. Because she's got the ammonia coming up too. And again, ammonia can be a real problem, especially if she's constipated, because remember, this doesn't just stay in the colon. This actually can seep out and get into your bloodstream and, like, you know, cause problems for your kidneys and your liver and your brain. And so, you know, with her, especially with her history and seeing this, I'd want to make sure that she's eliminating better and having daily bowel movements, and whatever your favorite way to encourage that is, you know, you could do that. And we'll talk about treatments as we get to the end as well. But for sure with ammonia, you want to get that out. You don't want that sitting in there too long and causing problems for kidney, liver, and again, even the brain. And then also, you know, glutamine, I just want to mention, you want to be careful, because we probably learned, a lot of us learned, you know, you could throw glutamine down to help like soothe the GI tract lining. But when somebody has too much ammonia, you know, that can actually cause problems where the glutamine feeds the bacteria that secrete the ammonia and actually can make it worse. So just a little pearl like side note to be careful with the glutamine in somebody that has ammonia. So I'd want to be careful with her as well. Okay, so then we're also looking for hydrogen sulfide and methane production, which again is giving us clues about SIBO. And if you remember, she has the history of SIBO. So again, I'm very suspicious that this wasn't completely treated, or maybe at all. I mean, it sounds like she was diagnosed at some point. And so I'm suspicious that this is obviously still simmering for her, and not the hydrogen sulfide version, but more of the methane version here, since you could see her methane production is increased. And remember, the euarchaeota are the microorganisms that are producing more of the methane here. And so balance is going to be the key. We really want to help her get these methane producers down, right? And how do we do that? Again, we got to get our foundational guys, our keystones, in good shape. Otherwise, it's not going to be helpful. And again, getting her to be able to have daily bowel movements is going to be good. So it's going to be important to help eliminate the methane as well. So, okay, let's keep going. Let's see, the psychobiome is next. All right, this is really cool. We're looking at hormones and neurotransmitters, and you can see here GABA is really low. And this is not her serum GABA. This is the GABA that is being produced by the bacteria that we are finding in the gut, right? So it's kind of confusing sometimes, because we think about like our own host level, and it's a symbiotic relationship, right? But when we don't see the GABA there, is that because the host is taking it, right, and depleting the bacteria? Or is the bacteria just not making it? So it's unclear. But a lot of times I'll see with not detected or low GABA, anxiety, trouble relaxing, and sleep problems. And so, I'm curious about that with her. She said she sleeps 6 or 7 hours a night. I don't know how well. So I would be suspicious, like, okay, this could be something that could be helpful for her as well. And so again, you could supplement somebody to help with GABA if you see this, knowing that it's not their serum levels or their host levels, it's more just what we see in the gut, if that makes sense. And then the glutathione is the same thing. This is like the glutathione that's being made in the gut from these guys correlates though to what we see in the whole body. So having this be in a good range, which it is for her, is really important and helpful because it also helps stimulate some of the GABA production in there as well. So this is good in terms of glutathione, but we want to work on that GABA piece for her as well. And then let's see. This is more details about the pathways of gut inflammation. So if you feel like diving into this more, this will show you how everything kind of relates to each other and how things are causing problems. And then we started looking at histamine now, which is super interesting. And look, you can see she's a little bit high on her histamine production. Now, a lot of people might jump to like, oh, she needs to be on an antihistamine diet. And that can be helpful, but the thing is, like, why are there bacteria there that are producing histamine, right? And how can we get them in line? I'm always, as a functional doctor, trying to get to like underneath it instead of just band-aiding things on top, even though I was trained as a family medicine MD to give a pill for an ill. I always really like to understand like why and where's this happening. And so in terms of symptomatic treatment, because you might notice that she's having more histamine like reactions when she eats certain foods, you can certainly use supplements to help with like the histamine. But ultimately, we really want to get underneath it and figure out like how do we get the bacteria and the microorganisms that are producing histamine to go down, and how do we do that ultimately? Remember, she has a very low alpha diversity. She doesn't have a lot of bacteria there anyways. And then as you saw, she has a barely present keystone population. And so getting that really up and rolling is going to be super important to help that. And if she does have a SIBO situation going on, obviously we can work on that piece as well. And cool, Connie, yep. Glad you'll be able to watch the rest of this and you're getting some good information here. So then indoles, these are healthy for her. She's in a good place. These are created from breaking down your tryptophan, and obviously this can play a role in neurotransmitters and your serotonin. And as you know, your gut and your brain very tied together with your neurotransmitters. So, we really want enough indole there to protect your barrier, your GI tract barrier integrity, and make sure, to try to prevent that intestinal permeability kind of problem. And so I also found indoles are really helpful too, to have enough of to help you with some of the xenobiotics and things that we're getting exposed to in like plastics and stuff like that. So it's good that she has a good amount present here as well. In terms of the sex hormones, the estrobolome, this is really just looking at the estrogen recycling again, looking at it through the lens of what's happening in the colon, right, in the GI tract. And so we want this green, you want this low, especially as a woman. You don't want too much estrogen, or men really getting recycled back into the body. You want it being eliminated. So again, someone who's constipated or not eliminating well, it's going to be really important for them to be able to get that out. And then also make sure, you have enough bacteria that are helping you excrete the estrogen. If you guys have somebody where you do this test and this actually ends up higher, you're going to want to think about further testing for them. And there's lots of different tests that you can do for that, like your Dutch or your ZRT or whatever you prefer in terms of more hormone testing. But this is, again, clues and overview as to what's going on in terms of this patient. And specifically what's going on with her gut and the microbiome functioning. And then this last section is looking at the biosynthesis of your vitamins, again, in the lens of what are the bacteria in the colon doing to create and produce vitamins. It's again, symbiotic relationship, right? But these numbers do not necessarily correlate to serum levels. So it's a little confusing. But again, I think about it in terms of like symbiosis, right? Like we as the host and the bacteria, the microorganisms in the microbiome are living there together, and then they create some of the vitamins, and sometimes we need them, and then sometimes we take the vitamins and get it from our nutrients and stuff, and then they use them. But ultimately, this test is looking at like how well are these bacteria that we found creating them. And so you can see overall, she's not doing well. Not surprising, right? Because her keystones were in the garbage, right? They were so low. And then other functioning was down. So this is not surprising. And so, yeah, this is a good question, David, in terms of, you know, when the vitamin biosynthesis is low, like we see it, but then all of the B vitamins are within normal range. So then that makes me wonder, is she throwing extra vitamins down there, right? Like, if she's taking an extra supplemental B complex, for example, you can see high levels, and that's my suspicion with her. Not the B7 here, but like all the other ones are high, and especially her folate and her B12. That makes me think she's probably throwing excess B vitamins down there, and these bacteria are like utilizing them, but overall they're not creating and making them. Yeah, exactly. Yeah, so it can be, again, it's not a direct diagnosis of anything in particular, but that's my understanding of how that can happen. And so then it's like, okay, then it probably is good that she's taking those extra supplements. I mean, the extra B vitamins in particular, right? Because this is what her actual bacteria are doing by themselves. And so I would encourage her to stay on them then in that sense. And then she's getting what she needs in that sense, but it's not, it's not necessarily equivalent to what you will see in the blood, in the serum. How can you see higher levels of Bs when the test is only measuring bacteria? It measures bacteria and, remember, other microorganisms that are in the colon sample. So that's the idea. It's not just the keystones, remember, like they do make some of these things, but it's not just what the keystones are doing. It's an overall picture of what they found in the test result, if that makes sense. And then her K2 is good too. And again, a lot of people are taking the K2, especially with like the vitamin D. And so, you know, we want to make sure, that we get enough of that. Yeah. And so, so overall, for this patient, let's talk about what we found with her overall. So overall, again, if we go back up here to the summary page, we can see here we go. Remember, her alpha diversity was really low. So, you know, we really need to work on increasing the number of species. And then, you know, she's having really poor, really low keystone species, of course, that's a big problem. And because of that, she's having poor short chain fatty acid production. We also saw she's having, remember, the Euarchaeota was high, and remember that was the methanobacter that we saw here. And so, you know, I'm suspicious that there's some methanogens, and also with the streptococcaceae in there. Maybe SIBO is still a problem for her, so we can consider further testing for that. She's got a little bit of the overgrowth, remember, of the Bacteroides fragilis, but not the actual virulence factors. And so it's not necessarily a serious pathogen, but again, balance is what we're looking for. And then remember, she had the increased phenols, ammonia, and histamine, which are just more inflammatory markers. And so balance is the key. We really want to get this balance. So in terms of what I would want to do with her, you know, as a treatment plan, I would be very interested in doing more SIBO testing for her, just to really diagnose and see, like, does she have, you know, the methane dominant SIBO? Because that's my suspicion based on the clues of the test. And if she does, you know, we want to work on that. We also want to decrease these methanogens in general, even if it's not formally SIBO. And you could do that with things like gingerols or artichoke leaf, you know, can really help with this issue. And Megagard is a supplement that can help with this issue and using that. So you can totally use that. You can also try like high dose allicin, like from garlic, can be helpful as well. And then we really want to support our upper GI function, right, and digestion. And so you could do that with like digestive bitters. You can do digestive enzymes, berberine. You could really stimulate the vagal nerve, whatever floats your boat in terms of encouraging and improving primary digestion, break stuff down better so that the nutrients are getting broken down more by the time they get to the colon, and then the bacteria can actually, and the microorganisms can use it better. For her especially, I want to increase her GI motility. I want to make sure she's having daily good bowel movements. So she's getting toxins and inflammatory byproducts out. I personally like to use magnesium citrate or natural calm. It's like super easy, not dependent and all that. But some people don't do well on that or don't like it. You could use your vitamin C, you could use Cape aloe, whatever you prefer, but just keep that motility moving. And then in terms of increasing our alpha diversity with this overgrowth of the Bacteroides fragilis, you could do something like an H258 supplement along with some fiber-free probiotics and like polyphenols or sun fiber to really help her start to build those keystones back up. Because remember, if we look at her keystones, she basically has none. And especially when there's, you know, no ruminococcus, there's no Akkermansia, like she's going to have trouble with fiber initially because she just doesn't even have the ability to process and digest them. And so, so we want to go slow with that and really help her, you know, start to push the bad guys down a little bit with that H258 and really start to build up your keystones, which I like to seed and feed the keystones with megaspore and then mega pre. And especially if there's no ruminococcus, which, you know, one of them's high, but the other one's kind of low, I would do megaspore first and get her up to dose on that, and then add in the mega pre after that. So that's kind of like my overview general plan that I would want to do with her. There's a lot of different ways that you can do this. This is not by any means the end all be all only way, but I wanted to give you guys just an example of how I think about it and how you can go about and approach this. And so that's it. I got through the whole report for you guys. I'm happy to answer other questions if you do have them in the chat. If not, I can hand things over. Let's see. Yeah, let's see. We could talk about Al. Yeah, Al. Yeah, we could totally set up a time to talk about your question. Let's see. Looks like the other questions have been answered. How does the presence and influence of this influence? Okay, so David asked about MTHFR mutation is common. How does it the presence of this influence how you support the microbiome? So, you know, with the MTHFR, I'm always thinking about detoxing is not working as well. So I want to make sure, again, they're limiting really well. And then sometimes methylated forms of the vitamins are going to be more helpful because, you know, with the MTHFR mutation, you're not able to create the active forms as much as you want. So that's kind of how I would use the MTHFR information in terms of what I see. And then you could do your H258, Debbie. You could do it for like 1 or 2 months, really just to kind of get it's got a lot of antimicrobial properties to it. So you could really help to get some of that Bacteroides down. And you're still kind of helping to seed some of the keystones, and then you could switch over after 1 or 2 months. I would do it that way. And then, let's see, if glutathione, see if it's high. A lot of times if the glutathione is high, I think about external supplementation. Like somebody is taking extra glutathione or a derivative of it. And so I'm not necessarily worried about it being super high. I don't know how high you've seen it, but I'm much more worried about it being low just because of its importance with the antioxidants throughout the body. I think, is there a mold high glutathione connection? That's a good question. Not that I'm aware of, but I'm not an expert in mold by any means. So that's a good question, Cynthia. I'd be interested in knowing if that's a connection as well. Yeah, you're so welcome, David. I think I hit all your questions. If I didn't, feel free to repost it because I might have missed it. I'm looking. I think I did. Okay, cool. Let's see.
Fantastic. Thank you so much, Dr. Feldman. Everyone, thank you so much for joining us here today. And if you have more questions, please work through your local account manager. We're happy to funnel them through and filter them over and get all of your pressing questions answered. Just so you know, if you do run a BiomeFx test, you can do a consultation, a 60-minute consultation with Dr. Feldman, reviewing the case report, the findings, and developing that treatment plan together. It's a really high value way to spitball ideas and really dig deeper into the details of either your own report or one of your complicated patients. We get the greatest feedback from Dr. Feldman's consultations. We really value her. And then today and through the month of September, a little bit into October, we are offering a special 15% off of BiomeFx kits. So if you're curious about becoming that microbiome expert, learning about all the bacteria and becoming an amateur microbiologist like us, then I encourage you to keep staying curious and dig deeper into the information. So thanks again, Dr. Feldman. We really appreciate having you here and having you on our team.
Thank you, guys. I'm glad you're all able to join me. And yep, I'll be available for consults if you guys ever want to book with me.
Phenomenal. Next week, we have another one of our BiomeFx consultants doing a case study, Dr. Frank Ervolino, who is an expert in herbal medicine, Chinese medicine, acupuncture. He'll take a different take. So we all have our own styles. We find that our clients find someone that they really love and align with. And so we'll have another perspective on a BiomeFx case study. So hope to see you then for your lunch and learn session with us, and have a wonderful day. Okay, bye.
Bye.